My name is Kevin Deitel and I'm an orthopedic surgeon specializing in spinal disorders. I've always wanted to become a doctor. My dad was a doctor. My uncles, my cousins, many people in my family were doctors. It was only natural for me to go into medicine. And as a child, I was always the person to fix things at home. I was always taking things apart and putting them back together and fixing things from a young age. So it really seemed to fit very well into what you do as an orthopedic surgeon, where you're mechanically figuring out how things work and how do you make things work again and work better. I was always interested in surgery, and I was considering what specialty that I wanted to do, and I did a rotation in orthopedics, and I really liked the people. I thought it was really interesting that they were focusing on getting people back to their activities and that you're able to really make a difference in their lives. And so that's what led me into orthopedic surgery, and in orthopedics was very interested in trauma surgery as well as in spine surgery. And I thought the interesting part about spine surgery is that it's very mathematical. There's a lot of thinking. You're evaluating different types of diagnostic studies to kind of figure out why somebody's having a problem. My approach to treating patients is that I like to treat people as individuals. I like to give them my full attention. I also like to have a very careful and conservative approach and make sure that any other potential option other than surgery has been fully exhausted before going ahead with surgery. Surgery is a big decision, and you want to make sure that you have all the information collected, that you're confident that it's the right thing to do. My areas of practice that I'm most fascinated by are minimally invasive techniques for spine surgery. Basically, by doing things through smaller incisions, the patients have a much quicker recovery and they have a lot less pain afterwards, and overall I think that they do a lot better. Physical therapy is extremely important in the person regaining their motion, regaining their strength, and being able to return to all their activities. So the rehabilitation of the spine is critical in the care of a spinal patient after surgery. Well, one of the great things about Ventura Orthopedics is that we have our own physical therapy department, and the physical therapists that work for us are very independent, but they also communicate with us. And as a result, they have a very strong idea about what it is that we're looking for. If they have any problems, they're quick to contact us, and there's much greater teamwork where the patient not only gets their surgical treatment, but their post-operative care is also through Ventura Orthopedics. And I think that's a really big advantage to the patient's overall success. Well, I'm married and I have 3 children, aged 13, 12, and 10. And they take up a lot of my time and do a lot of family events. My kids are very active, and we do schoolwork and social activities. And we went to Israel last summer, and we also ski. I assist coaching in hockey with my son. It is fun to see the enthusiasm that he has for the game. I still haven't lost my enthusiasm, but it's something that we can do together, and it's a lot of fun and something that the two of us can share. Well, as a kid, I was always very interested in ice hockey. Aside from school, I've always played hockey. I've always been a big fan and interested in it. Every year I play in a charity hockey tournament in Canada, and it's a big tournament that raises money for Alzheimer's research. It's a very successful tournament, and it's a combination of regular hockey players and ex-professional athletes, and so it's a chance to get to meet some of your idols and play hockey with them and have a great time and raise money for a good cause. Well, it's a lot of fun to play hockey with other people, and of course, as you get older, it's harder and harder to play a sport like hockey because of the speed and the physical aspect of it, but it's still a lot of fun to be able to get on the ice and have a good time.